So from the very first minute, I was really reading up on everything. I was reading about early treatments all across the world. By February of 2020, before most of you even heard of it, we already knew hydroxychloroquine worked. How did we know that? Here's a dirty little secret. It's called SARS-2, right? SARS-2? That implies there's a SARS-1. And in fact, indeed, there was a SARS-1 15 years earlier, also from China. Shock. So they had done studies, and it turned out hydroxychloroquine worked very well on SARS-1. So unsurprisingly, scientists went ahead and said, well, let's see if it works on SARS-2, because in fact, SARS-1 and SARS-2 are 78% identical. Lo and behold, not a shock. It worked really, really well. So those studies started coming out by February of 2020. This is right around the time, like March of 2020. To put this in perspective for you, rather, Donald Trump spoke out encouragingly about hydroxychloroquine. I think it was March 17th, thereabouts, 2020. So this is really before people were even so panicked. In other words, we knew we had resources long before you all were panicked. Or maybe not this room, but long before the American population was really panicked. So it was planned that people should get worried and nervous, because the normal response would have been, you know what, we had a similar virus 15 years ago, we got some meds, we're going to try it. That would have been a normal response. This was such an abnormal response what happened.